Hello, this is Chadi Alraies, CVI 2019, Denver, Colorado. With me is Mitul Kanzaria. He is an early career practicing in Atlanticare in New Jersey. Welcome, Mitul.
Thanks.
So we are hosting you for the first time talking about early career tips and tricks. You've been there for a couple of years, or probably 2 years, and would like to hear from you what is the obstacles, how to overcome them.
There have been some interesting challenges, good things, bad things. I would say a lot of things you don't learn in training, such as how you code and bill, what an RVU is and what the meaning implications of that. And then even from interventional cardiology or cardiology, a lot of questions we don't know the answers to, and how do you approach those problems coming to conferences like this and asking questions of that you're encountering.
So when you come in early career, you have so many challenges. You want to build up your business. You're going to be a good operator, a good outcome. You keep learning, and again, as you said, you have to watch the business aspect. So how to juggle all this?
Yeah, I think early on, you need to lean on some of your more senior partners if you're going to take on some challenging cases. You definitely don't want to be running into a lot of complications early on, and just as you get your feet wet and understand your own propensity to take on challenging cases, it's nice to have senior partners help you out. I've been fortunate to have that in my practice, and now feel more comfortable taking on some more challenging cases on my own.
Right.
And then doing things, you have to create your own style coming out of fellowship. You're used to your mentors and doing things in a certain way, and now it's time for you to develop your own style, and they don't always have to align completely, but just takes time to develop that style.
Absolutely. What's your advice for the billing and understanding the business in medicine?
A couple of things. I think when in training, asking your attendings, how do you bill this? What are the things that you're thinking about, and how you approach billing. Once you're in practice, I found really helpful to meet with your compliance people, ask them to audit some of your notes, some of your charges, bills, and see, are you doing things okay? Again, leaning on some of your senior partners to understand how billing is going, and maybe not even your senior partners. One of the people who was most helpful for me was somebody who was about 2 years out of fellowship now, kind of understanding what I was going through in terms of challenges for billing, and peppering them with a lot of questions of how do you bill, how do you document, are you sure you're underbilling, overbilling, how to avoid those challenges. So just really ask a lot of questions, and really, compliance people, they'll want to meet with you. They're really anxious and are willing to answer a lot of those questions. They'll give guides of where your documentation is and how do you bill appropriate.
And tell us about your regular day, starting from round or clinic, doing procedures, and then going home back to your family.
Yeah, long days, starting 7:30 in the morning. We have sign out with our group, and then my practice is a mix of some general cardiology plus interventional, and so on any given day I may be rounding and doing cases, plus doing TEs, echoes, nukes, a little bit of everything. So balancing that with then also filling up your clinic schedule and trying to get more patients in the office.
Right.
It's really rigorous. It's challenging from a work-life balance, especially early on while you're trying to build your practice. So some late nights, your family needs to be understanding of that, and
especially at the beginning.
Yeah,
right.
With young kids, it's hard.
So the goal is, as you said, the goal is to build a clinic, right? You have a clinic-based volume of patients that's probably going to be your core for either for the cath lab or for rounding, right?
Yeah, exactly. I think you bring up a really good point. Your long-term sustainability, or your value that you bring to a hospital or your practice, is your outpatient practice, and those people stick with you through thick and thin, and if you develop good relationships with your patients and have a really robust outpatient practice, that's like a real key to long-term success. You can get referrals from, primary care providers, follow-ups from the hospital, but I found actually my biggest referral is from patients, giving my name to other, family and friends, and
because you spend the time, you invest with them.
Yeah, and just talk to them like they're humans, and
Right.
they really appreciate that. Spend time with them, understand what they're going through and the challenges that they're facing.
Well, those are all great tips for the early career and people who are starting in practice after fellowship in the first 5 years. Thanks, Mitul, for your time.
Thank you,
Great
Chadi.
tips. And please watch these videos and others on CVI 29 YouTube channel. This is Chadi Alraies from Denver, Colorado.